We're here. This is the DSO Study Club webinar series from Group Dentistry Now. I'm Bill Neumann. Thanks for being here today. We will be respectful of your time, stick to an hour. We actually got a lot of great questions from the people that have registered, the attendees. So what we've really done is we've designed this as a panel discussion. We'll do some brief intros and then talk a little bit about rectangle health. And then we're going to get into the questions that the audience really has asked us. And there's some really good ones. And what you find when you require questions, you get a lot of questions, and you find a lot of them tend to be very similar. But I think we have about 15 questions. We might not be able to get to all of them. And if you have any questions that we don't answer during the panel discussion, you can just shoot them out in the chat or in the Q&A, and we will get to them. And if we happen not to have the time, we'll make sure we follow up with you after the fact. So this is the Improving Patient Payments Through Engagement and Digital First Tools. We have Brian Doyle and Mike Peluso from Rectangle Health. So thanks, guys, for being here. We appreciate it. I'm going to let, as we advance, there we go. So Mike is the Chief Technology Officer, and we have Brian, who is the Vice President of Enterprise. I'm going to let Brian start things off. You want to do just a brief introduction, who you are and what you do at Rectangle Health.
Thanks, Bill, and thanks for setting this up. And it was great at your show 2 weeks ago as well. It was great to see a lot of people in person finally. So thanks for everyone for joining. My name is Brian Doyle. I've been in the patient payment industry now for about 12 years. I currently am the Vice President at Rectangle Health. What I do and what my team specifically focuses on is providing patient payment solutions for dental organizations, DSOs, GPOs, et cetera. We pride ourselves on providing a streamlined, contactless, and efficient payment solution. We want to become an extension or a partner of our organizations. So this is it's a pretty cool topic. We're going to go through a lot of what I heard about the past 2 weeks. I was at 2 dental shows actually, is acquisition and growth in the DSO world. How do we streamline that? How do we get better? Which inevitably leads to how do we improve our staff's efficiencies? How do we improve the patient experience? How do we improve what is going on inside the clinic? And to me, that all stems back to technology, which is a lot of what we're going to talk about today. And what differentiates payments, patient payments versus technology solutions. And between myself and Mike, we have a lot of years of experience in this industry. So I'm pretty excited to go through in more detail what we've seen work and what best practices are in the dental space.
Yes, thanks, Brian. Yeah, I would agree. That being at a couple of the DSO shows in recent weeks, which is great to get back at it, right, and actually be with people in person, and even before that with some of the virtual meetings that I've attended, I would say certainly themes wrapped around workflow efficiency, acquisition. So growth in general, but whether it's you're acquiring practices or even adding practices, de novo practices, there's just a lot of talk about that. And then I would also say one of the other things from a growth perspective is that same store growth. So you've got a practice that you want to, you've got more opportunity. So how do you create more opportunity at that same location? Let's let Mike jump in here. Mike is the Chief Technology Officer at Rectangle Health. So Mike, welcome to the webinar.
Thanks, Bill. Thanks. It's great to be here. I'm a little upset that I missed the Group Dentistry Now actual seminar. I'm gonna expect a personal invite for next year. But really just to introduce myself and give a little background about Rectangle Health. Again, Chief Technology Officer, as you mentioned. What I do is I drive all the innovation for the organization. I drive all the strategy for the organization. And really that's all built on customer interaction. We build based off of what we think our customers' needs are, based off of what we think the industry needs are. And we've done that since our inception. And our inception 27 years ago was really based on dental practices, purely focused on dental practices at the time, not being able to collect from patients at the point of care. That was our original idea. How could we solve that problem? And the idea at the time was, well, we can allow those offices to process credit cards. As I say that today, everyone goes, well, that seems pretty logical. 27 years ago, it wasn't all that logical. You used your credit card at the gas station or the grocery store. You didn't use it at the dental office. The dental office sent you a bill, and then maybe you paid that bill. It's actually still like that quite a bit today, but we'd like to think we've made a dent in it with our technology. And that's the other side of Rectangle Health is we really identify those problems. Again, the problem I just outlined, patient not paying at the point of service. We really identify those problems and layer in solutions. And over the years, we've built out solutions, specifically our practice management bridge solution, that allows the practice to interact with a patient, that allows a practice to connect with a patient, not just around patient payments, which is critical. We'll talk a lot about that today, but just around patient interaction. Even recently with something like COVID. I know we all mention COVID a lot, but that patient interaction now is a lot more digital than it used to be. You want to be able to text patients. You want to be able to interact with patients online. You want to be able to collect from patients via a website. Those types of things are what Rectangle Health continuously tries to build on, continuously tries to add for dental practices every single day. And then with software, we kind of gain the ability to deliver that at scale. Software allows you to deliver, a really good product to a lot of organizations, especially when you think of the cloud, something like AWS. AWS allows you to build an application and deploy it to thousands, if not millions of people. We leverage that type of technology to really help dental offices, to really help the industry understand that it's not all that difficult to engage your patients. It's not all that difficult to get patients to pay when you have these types of tools in place.
Thanks, Mike. It's interesting. You talk about that, and you talk about COVID almost kind of pushing things, the industry, everything, not just the industry, everything online, right? As much as you can do online, as much as you can do virtually, and I feel like almost this consumerization, right, of the industry. Of everything. People used to ordering things online, Amazon, of course, doing that. Dentistry always seemed to lag a little bit behind. And again, I think with COVID just forced the issue. Mm-hmm. And really, it's a good thing. One other thing I kind of wanted to mention before we get into the objectives and what we're going to talk about today, discuss. And again, I mentioned that we're going to do a panel discussion and answer a lot of the questions that the audience, the attendees have already provided us. Rectangle Health has been, and I think Mike mentioned it, for work in a lot of years working, but almost in the background. So whether it's maybe not a household name in the dental industry, Rectangle Health has been around for a while.
Yeah, absolutely. Again, that 27 years, and again, I like your comment of they've kind of been in the background. It's almost on purpose. We certainly want everybody to know our company name. I think everybody wants everyone to know their company name, but we don't want to be that interrupter. We want to be that section that kind of helps the practice do what they need to do and almost live behind the scenes, just like you said.
So Mike and Brian, what we'll do here is we'll just go over some of the objectives and then we'll get into the Q&A. And again, if anybody has any questions as we move along, just type them in, please. So this webinar, we're going to make sure we cover here how dental patients' preferences have shifted from high touch to high tech. Talk a little bit about what that means. How meeting patients' digital expectations can drive loyalty. And I think this is really important. And it's almost an expectation now, right? So there's a loyalty. And then, of course, that translates into revenue for the practice and then for the DSO itself. How patient technology can reduce manual processes and improve staff efficiency. And I think this is really critical with the HR crisis that we see, right? You have people doing manual processes, you have less people working now. So, how do you kind of take manual processes away from individuals and really have them focus on, what their job is, or to do other things when you're short-staffed. how to gain team buy-in and make technology implementation a priority. And that last bullet's kind of interesting. We saw that question come up from a couple of the people that have registered for this. Again, we know who these gentlemen are. The contact information will be back up at the end of this presentation. So what we're going to do now is we're going to jump into the Q&A here, and we'll make sure that everybody can see our faces. So with that, we're going to get into the Q&A. And this first one here, this is for you, Mike. And this one was actually from a larger group, but how does Rectangle Health work with existing patient payment tools so as not to disrupt a practice's workflow? So I think that's pretty important. And we see workflow kind of come up in a lot of these questions.
Yeah, for sure. And we hear a lot of words when we talk about applications like seamless and frictionless, and it won't interrupt your workflow. And that's the way we design the system. As I said, we kind of design it to work in the background. We kind of design it to enable where it needs to enable, meaning at the point of care when a patient's checking out, we want the system to automatically sort of pop up and say, don't forget to collect from the patient, or the ability to send a text. But when we say that it's disruptive, again, if you were to go to any other industry, if you were to go to the grocery store and say, do you think your checkout process is disruptive? Like, well, if we didn't have the checkout process where people paid at the register, what would be the point of having a process at all? The point is, and the point I'm trying to make is you want to collect revenue. You want to collect patient payments. You want to get those copays. You want to get those deductibles. You want to get that money as easily as you can for the patients. And that process, you're right, it shouldn't disrupt it, but the function should almost be invisible. It should be part of the practice. It should be part of the core of the practice, part of the culture of the practice. It's part of the core and culture of everything else we do in our daily lives. You can't go to the gas station and drive away without paying. You can't even pump the gas without giving them your card. You got to insert your card first, and then you could pump the gas. Think of that same sort of workflow or that same invisible function within dental, within the dental practices where payment is just embedded into everything. So it's not disrupting the workflow. It's necessary to enable the workflow. And that's really what we try to do with Practice Management Bridge. And that's really what we try to do just in general when we talk to practices. We've been doing this, again, like we said, for a lot of years, and we have a lot of sort of practice at it, and we have a lot of understanding, a lot of knowledge. And really, it's all about making payments, not a disruptive thing, making payments an embedded, invisible process in everything you do when you're delivering care to patients.
So you mentioned one of the products. So it's called the Practice Management Bridge. Can you talk a little bit about that? Just give us an idea, kind of what that means and does, if you don't mind, Mike.
Yeah, absolutely. So cloud-based technology that we're going to deliver to dental practices, and what it does is again, it drives that payment at critical points, right? So think about it. And again, I'm going to use a lot of retail experiences just because they help sort of drive my point home. Whenever you walk into a pharmacy to take a prescription, the first thing you see is that payment device. Well, whenever you walk into a dental office that has Practice Management Bridge, the first thing you're going to see is that same payment device where someone could insert their card, someone could wave their iPhone over it. You can even have signature capture on there. So that's one critical component that, again, triggers a patient mentally. I'm going to have to pay at this dental visit today. So it's really helpful. And that's part of Practice Management Bridge. The second part of Practice Management Bridge, and really, as I mentioned before, it kind of came out of COVID. Hey, patient, you're coming into the office. Before you get here, why don't you leave your card on file with the office? So I can send a message to the patient that says, we know you're going to come in. We know what your services are going to be, or maybe we don't know what your services are going to be, but we're going to get your card on file before you come. Again, to avoid having to leave it in the office. And again, if you think of companies that have just sort of nailed this, Amazon's a good example, Netflix is a good example where you can't consume their services unless you leave a card on file ahead of time.
Right.
The Practice Management Bridge can actually do that for a dental office. And then the last piece is ultimately, and again, dental offices are a little behind the curve, and we're trying to push them ahead of the curve with Practice Management Bridge. Simply a way for the patient to pay online or from their phone. send a text to a patient, you have a balance due of XYZ. Would you like to pay that? Sure. And they go ahead and pay. And Bill, if you think about that, you can do that on day 0. That's something we worked out with Aspen Dental, the ability for a patient to pay via text at day 0. Not day 1, not day 30, not day 40, day 0. Some of them get the text while they're still in the chair. And what that does is, wow, payment is top of mind. If you leave the dental office and 30 days later, a paper statement shows up at your house, you're kind of not that engaged in it. Not that you don't want to pay your bills, but you're not that engaged in it, so that urgency doesn't happen. Text creates that urgency. Online payments creates also the convenience for that patient when they do want to pay, to just go to a website and make a payment. So when you think of Practice Management Bridge and everything it does, that's what it offers to dental practices. That's what it offers to DSOs. We even have it deployed at a lot of medical practices as well.
Let me get one more question for you, Mike,
Sure.
and then I want to get to Brian on this, because when you just mentioned medical, do you feel that is medical, or the medical practices a little bit further along with this than you'd say dental, or what are your thoughts around that?
You can check the attendee list. Hopefully there's no medical practices attending today, but they're actually farther behind. Dental is farther ahead than medical when it comes to addressing patient payment, and it comes to addressing patient interaction. A lot of times it's not easy to walk out of the dental office without paying. It certainly happens. Medical offices, it happens a lot. So to answer your question, I actually will give dental the credit here. We'll give dental the win here. They're farther ahead than medical.
We'll take it. That's good. It's good to hear. So Brian, this ties really closely into what Mike was talking about. So this is another question that came in. We'll get a little bit deeper as why DSOs and the providers need to be thinking about and prioritizing digital tools for patient payments. And I like this part. Really, it's not just the payment part, because when Mike's talking about it, you talk about the text and it's engagement as well, right? So it's, obviously the payment is what you're getting, but you're engaging them in different ways, right? Whether it's that text, it's things like that. You're constantly communicating with them, which is great.
Yeah, absolutely. So the engagement piece, and especially, when we think about what COVID did, this piece of our solution absolutely exploded. Because when you think about how I'm allowed to go to the dental office today versus 2019, it's different. Things are different. The idea of walking in, sitting in a waiting room, filling out a piece of paper on a clipboard, handing that back, going through that whole process is essentially being eliminated due to necessary steps during COVID and then just modern technology. When I think about how I check in for my flights, I don't go to the kiosk. I check in on my phone and walk to security with my iPhone, right? That is the way the industry, consumers, so patients, are used to engaging with whatever service they're using. Bill, someone at your show in San Francisco said this to me, actually. My company booked this hotel for me. What's the first thing the hotel asked me for when I checked in? It's my card for incidentals. This is commonplace. So this engagement, this digital presence that we use in every single day in the consumer world, we're providing that to healthcare. So what it does to the consumer or the patient, we're actually seeing statistics that says the patients will shop their dental experience based off the technology the dental office is practicing. For example, if I have to call or if I have to email and hope I get an appointment, odds are I'm going to go to the next website that allows me to book the appointment on a calendar when I need to do it. Conversely, I just went through this yesterday. I booked a dental appointment. They sent me like 7 PDFs to fill in, print out, and bring in with me. My printer in my home office doesn't work. So naturally, I'm not going to fill those forms in. So I will have to figure it out when I walk into the practice. Now think about if they text me that and I could just fill it in while I'm sitting in my car in the parking lot or sitting in the waiting room or sitting having dinner tonight. I could fill that in very quickly, scan my insurance card. I'm not going to mess up the group ID versus the member ID. All of that is ready to go and very well adopted, which I think is the most important thing here, well adopted by the patients today. So, I could rattle off statistics, but 60% of patients or consumers would rather fill in their forms digitally. So when we think about adoption in generation versus generation, this is broad across the board, that 60% of consumers or patients want these digital touch points. We all have our phones on us at all times. Mine is sitting right here while I'm doing this. It is my parents have it, my nieces have them. It is a generational, it spans all generations. So card on file, digital and rate engagement, all of that is necessary in today's environment.
So we have a question that came in. Let's touch on this now, since it's really pertinent to what Mike was speaking about, and you as well, Brian. So some of the examples that were included are, we talked about Amazon a little bit, right? But there's no insurance involved. So so from a patient's perspective, can you talk a little bit about maybe the differences in dealing with something that might have some type of insurance reimbursement versus, a purchase where it's completely out of pocket?
So I'll take the first one, and then maybe Brian can add on to mine. But that's where card on file comes into play. A patient presents at a dental office, and they are going to have some sort of out of pocket. Maybe we don't know what that exact out of pocket is. Maybe it's very low, right? But at that point in time, it can't be calculated because of insurance. And Bill, by the way, to your question before of why medical's farther behind than dental, there's a lot more insurance involved in the medical process and a lot more variability in the procedures. But on the dental side, again, patient presents, and yeah, absolutely, patient. You're right. We can't calculate the exact insurance. We're going to send a claim to the insurance company. They're going to send back in a balance. But we are going to deliver care to you today. We may send a claim to the insurance company, and we may say you're ineligible, depending on what that might be. But we are going to deliver care to you today. And in order to deliver that care, we're going to go ahead and get a card on file up front. And it's more that mindset of, okay, that makes sense. That makes sense. The dentist is going to see me. The dentist is going to have costs. There's a hygienist, there's office managers. There's all sorts of things going on in that office that do have costs. So as a consumer, again, we do this at a lot of other places, but I agree that there's sort of this insurance component. As a consumer, though, I'm okay going, all right, you can have my card on file. I get it. I understand why you would need it. I understand why other companies need it. I understand why you would need it. So I'm going to go ahead and leave my card on file. And the office isn't necessarily going to charge it. Right? It's just there as that financial security that, hey, you're a good patient. We're going to deliver some services to you. We're going to send a claim to your insurance company. Eventually, your insurance company is going to come back and have a balance due for you, patient. We still might not even charge the card on file. We'll maybe send you one paper statement or one electronic statement via text and give you the opportunity to pay it. And again, Bill, when you send it to the patient via that text, they can then pay it without keying it in because you, the office, already have it. So it's a lot of that automation around that patient experience and that ability for that patient to go, yeah, I get it. I probably owe something out of pocket. I get it. Dental office, you may not be able to calculate that right at this very second. I'm going to go ahead and leave my card on file. And when they're presented with the card on file, they're also presented with a dollar amount that they're comfortable with, meaning you can't charge more than $50 to my card on file. They're also presented with a time limit on their card on file, meaning this office is not going to keep your card on file forever. We're going to keep it for the next 90 days so that insurance does what it needs to do. So there's definitely an insurance component, and I totally understand that, but there's a way to discuss and manage around that so that the patient becomes very comfortable with doing something like card on file.
Yeah, piggyback on that. I can give you some statistics and then give you a little what I see on the day-to-day talking to DSO. So 56.5 actually % of consumers want card on file. It is just commonplace for us, Amazon, Netflix, just in general. Card on file is commonplace. So 56% of patients want card on file. On top of that, over 60% of patients want engagement via text. How does this help not only the patient, but the staff, the providers? Well, let's think about post-adjudication, and insurance covered a little bit less than what we thought. Imagine that one, right? And we're left with, let's call it $20 outstanding balance. We know what happens. We have to go through the billing process. We might send a paper statement out. When that paper statement hits, I open that statement. I'll use my wife as an example, actually. We just got a statement for $15 2 months ago. We opened it at 9 p.m. Office clearly isn't open. I had no way to pay online. What happens is next month that $14 comes again. Conversely, if you send me a text with that amount due and my card on file, I'm going to pay 77% of the time. So by making it easy, and that's what this all comes down to, patient experience, ease of use, streamlining the staff's workflows. All of that stems from card on file and pre-care, capture, et cetera. And then going another step further, we talk about price transparency. All of that plays into this. Hey, you owe us $50 now due to post-adjudication balances. We have card ending 1234. How would you like to pay? All of that plays into what consumers are looking for in today's healthcare environment.
So Brian, you talked a little bit about the text that would come through, and let's say you have $15 that you owe. What does that look like? Is it something you have the card on file, say, hey, end of the month, you owe $15. Would you like to pay with the card on file? Yes or no? Is that kind of what the text looks like?
Yeah, pretty much. Yeah,
Okay.
it's, we could brand them, customize them, really do whatever the DSOs want, because obviously the DSOs usually keep the brands they acquire, just the logos and what have you, Bill. So we could make them dynamic for the DSOs on a corporate level.
So you can really customize it depending on the DSO. If they have one brand like an Aspen, easy enough, right? But if they have local brands, you can do that as well.
That's right. So the patient, which is important, the patient has no idea who Rectangle is. We're just the software in the background. This all comes from the provider. So that makes them feel better about it. They're more likely to pay. All of that plays into it.
Yeah, and Bill, what we've done is we've kind of done this for 25,000 dental practices. It's what we've done for, again, the past 27 years. And think of us as a 27,000 location DSO. We figured this out. We figured out how to push it to our customers. And what we're actually going to do, and I wanted to mention this because I know some DSOs are on, we're actually going to package it all up so that they can distribute it as the DSO. Meaning Rectangle Health, and you hit it perfectly early on. We're just the guys in the background that built the technology. We can now take that experience and everything we've done with the technology and box it up and give it to a DSO so that then when the DSO is talking to their potential practices or practices that want to become part of the DSO, they can say, we have this digital product offering. We have it ready to go. We have a playbook. So when you sign on to the DSO or become part of the DSO or we join together and become a DSO, we're going to have this digital technology on the very first day. And it's going to be, and I'll just use XYZ DSO as the name. It's going to be XYZ DSO's technology. We're just facilitating it for that DSO so that they can distribute it to their customers. And essentially what it does is we lie in the background. We also cut out the middleman, which is ourselves. Now it's between the DSO delivering technology, it is Rectangle technology, and their DSO member base, their practices, receiving that technology. And it gives the DSO that modern appeal, which then filters down to the practices, that now these practices that are part of the DSO, and again, they're most likely joining the DSO maybe for better logos, better marketing, better, more patients to the practice. Now this becomes one of those additional tools. Now as part of the DSO, you get this digital patient tool, this digital patient payment tool, this digital patient engagement tool from Rectangle Health. Again, we distribute it to dental practices all day long, a couple hundred every single month. But now the DSOs can actually do it themselves with our offering.
Leads into a really great question. So if they're not using Rectangle Health, people behind the scenes, what are they doing right now? So what would a solo practice be doing? What might some other groups be doing now if they're not working with you?
Yeah, that's a great question. So Mike, I'll start and then obviously you could come in. So there's really two main options in the industry. There's your traditional merchant service. Everyone on this call knows that's a commodity we can really get anywhere we want. It's a basic terminal that sends your money to the bank. There's no technology outside of the hardware included. Then there is your integrated, more high-end technology functions. And we all know, Bill, you know a lot of these groups. There's a lot of cool softwares out there that are doing some engagement tools, some online stuff, some texting stuff. They're really cool functions. But to get an all-in solution, you have to piecemeal it. You have to use 2, 3. Some DSOs are using 10 different vendors, quite honestly. The other option is Rectangle Health. We come in and say, we're going to give you a consolidated solution that incorporates all those other functions you're using. And remember, we're a flexible software. Mike built an amazing product that we can work with some of the third parties, a lot of the third parties out there. But at the end of the day, we want to be your endpoint for anything patient payments and give you all the integrations and technology that otherwise you have to go shop the market for under one gateway. So it streamlines the staff's logins. You don't have to log into 6 different systems. You have one. It streamlines the patient experience. So if I come to, Bill, you have the endo practice, I'm going to the GP practice and then to the perio practice all in a week. I have the same experience because I'm part of going to that part of the DSO. So those are really the options. There's your traditional merchant service that is antiquated and we could call anywhere and get that service. Then you either have to piecemeal it together. And what we've come up with is a consolidated solution that incorporates all of that into one platform.
And specifically to reference the DSOs, we want the DSOs to be able to deliver it to their customers, or to their members, or to their practices. We don't need those member practices to call Rectangle Health. We can actually distribute it through the DSO so that the DSO kind of owns that experience with their customers. We can go direct to customers like we said before, but I think with the DSOs, we can actually package it in a way that it becomes their product offering. And like you said earlier, Bill, I keep picking on it, but I loved it. We're just kind of behind the scenes.
So it's interesting. If again, you're not working with Rectangle Health, let's talk a little bit about what DSOs are looking for. Again, I've got 2 or 3 locations, I'm scaling up, or I'm somebody that has 800 locations. With whatever they're using, whether it's, payments, whether it's practice management software, whatever, they want stats, right? They want to be able to benchmark and measure. So talk a little bit about the reporting behind the scenes. Like, what am I able to do? Can I look at this practice compared to this practice? Can I look at certain geography, if I'm at the regional manager level? That, and then Mike talked about it really early on there with one of the questions that had come in, which was a little bit about, there's certain things that you might want to, like best practices, like, so when somebody comes in and they maybe aren't really comfortable because there's some insurance involved. What does the training look like in onboarding? So a couple questions there, but let's talk a little bit about the reporting. I kind of think of from the DSO standpoint, and then the training piece, because again, you've got people that may have different comfort levels when it comes to being tech or non-tech savvy.
Awesome. Yeah, I'll take probably the reporting, some of the technology, and then we'll give Brian the training and sort of workflow enhancement. But around the reporting, exactly like you said, Bill, how do I see a picture of all of my practices? How do I look at, okay, I'm a 900 location DSO, or I'm a 50 location DSO. How can I look at those in aggregate? Meaning, how much did they all do together? Perfect. And how do I benchmark that over time? Meaning, looks like in January, we did X in payment volume. In February, we did Y. What's the difference? And that all that reporting is built in at that aggregate level. So you sort of top down, also within each individual practice. And then when you go into the individual practice, and this is where it can get kind of fun, you can actually look at different users within the practice. So you may have front desk operator Susie and front desk operator Betty in the same particular location. You can actually start to say, wow, Susie's really good at collecting patient payments. For some reason, Betty never asks anyone for patient payments. Or now you could go to a different practice and go, wow, this practice has has 95% of their patients giving us card on file. And look, their days in AR are the least of any other practice in the entire organization. That's where you can start to get really analytical with the reporting. And then the other important part of the reporting is reconciliation. Depending on how the DSO is structured, you may have one bank account for the entire organization, or you may have a separate bank account for each individual practice. Or depending on the size of the DSO, you may be regional and you have regional bank accounts depending on region. But every single day, every single transaction is getting posted back to the practice management systems. But then as the deposits flow to the various bank accounts, we want to be able to give that information to whomever wants to see it, from the practice level again, all the way up to maybe a CFO level, to really do the reconciliation from the accounting level to say, absolutely, the money that we're posting to the practice management system matches to the money that's hitting the bank account. And that's probably the other really important part of reporting and really important feature of our system is to facilitate that.
I'm going to hit that training, Brian.
Absolutely. Yeah. And one other thing I'll add about reporting is because we're a centralized platform, the finance team, the rev cycle team, the CFOs of the world, they literally go to one platform, sign in, and have that global view. Again, instead of bouncing around to different systems, it's a very small piece, but it's a powerful piece because without having no logins, you're more likely to do your job in a more efficient manner. And then in terms of training, implementation, like Mike said, we have 28, 30 years of experience and 25,000 some odd dental clinics. We understand, and we started down market, which I think is very interesting. We understand what one DDS, one operatory practice needs, wants, expects, all the way through some of the largest DSOs in the country. So we know what the front end staff needs. We understand that there needs to be cheat sheets and tutorials and et cetera. But we've created a user-friendly experience based off the feedback we've gotten over the last 20 some odd years of what the clinics are telling us works versus what doesn't. So our system is extremely intuitive, and we're involved in every single aspect of the training and implementation. I always like to say we're not a vendor, we're a partner. We become, and we mean this, an extension of your organization. So my team works directly with your teams to make sure everyone is trained and it's as seamless as it possibly can.
So, and we touched on this, both Mike and you, Brian, touched on this, but what about this issues with some patient populations that might not be tech savvy? So, whether it's geriatric or what have you, people just aren't comfortable with technology. Any thoughts around that? And then I would kind of tag on to that. And I know, again, you touched on this earlier, is not just from a patient side of things, but what about staff that might not be tech savvy? So you might have this apprehension.
So with sort of the patients on the tech savvy, and I get this question a lot, Bill. Everybody has a mobile phone today. I'll pick on my mother. She's in her 80s now. She has a mobile phone. So it's hard to comprehend that the tech savviness of the consumers isn't there. They're actually the ones driving the need for tech savviness in the offices. It's not office managers kind of going, oh, we need more digital payment solutions. It's actually patients going, and if I could just text to pay this office, life would be a lot easier. Or to Brian's example before, if I could just go online and pay this bill, the office wouldn't have to send me another bill. I'm going to go online and pay it. So the technology is driven inward from the patient base. I know there's geriatric out there. There's also children out there. Everybody seems to be walking around with a mobile phone these days. And I've tried, we could Google some statistics, but it's 85 to 90%, I'm sure, that is carrying around a smartphone. So they're really pushing that into the offices. And then as it goes into the offices, the office managers, the office staff needs to adopt that tech savviness as well. Now, what we try to do is, and you said it before, we try to make it almost invisible, meaning office, you have this great technology, practice management bridge. Patients are going to pay you via text to pay, really tech savvy, right? Office manager, guess what you have to do? Nothing. You don't have to do anything. You don't need to understand text to pay. You understand that a patient made a payment. You understand that that payment posted to your ledger, and everything kind of just worked. So when you think of the tech savviness of the office, it doesn't have to grow. It can, and I think it should as a technology guy, but it doesn't have to when it comes to applications like ours. We're going to make it so that, so again, it's invisible. That payment is just happening. The office manager doesn't have to do anything to make it happen. And that's what sort of the beauty of our application.
That's great. So there really isn't any, there shouldn't be any apprehension because they don't see any difference from what they might have used when they were at the solo practice. And then as they're acquired with the DSO, it's pretty much it's seamless.
Absolutely. Absolutely. It's almost, and I would almost go as far to say it's easier. Because now payments are happening without any human intervention. And that's a pretty interesting concept, right? Patients are paying you. They're getting their balance due, and that balance due is getting texted to them, or even if they're getting a paper statement, which really happens without any interaction as well, and they're going online and paying it. Those payments are just sort of happening. Even that patient that's coming to the front office or the point of care and making a payment, they're waving their iPhone over the device, and the payment's processing, and it's posting to the ledger, right? Before, and then we go sort of old school, Bill. Before, somebody had to take that patient's credit card, someone had to swipe it through some sort of device, someone had to print out a receipt, someone had to go back into the ledger, key it in by hand. Not that that's a tech savvy example, but it's a lot of work. Now payments are happening. They just sort of occur. And again, just steal the example from like an Amazon or a Netflix. Netflix probably bills out, let's just say, a couple $1 billion every single month. Their days in AR are zero. The amount of patient balance or the amount of patient statements they send out, also zero. Yet somehow they collect all of this money every single month. Again, because it's kind of just, it's happening. So yeah, it doesn't require a lot of tech savviness from the office staff, Bill. It also doesn't require a lot of effort either. So it's definitely a win-win.
Yeah.
That's great. I saw somebody, Dr. Dijkstra raised his hand. I didn't see a question come in, but he's with MI Smiles Group. So maybe just waving and saying hi. Hi, Dr. Dijkstra. If you have any questions, type them in the chat or the Q&A. I don't think I missed anything in there, but good to have you on. So here's another question as well. This actually came up and it touches on what you were talking a little bit earlier about the card on file. So this one is more about setting up payment plans for patients using credit cards that are on file, and can an agreement talk a little bit about like length of like time? They were asking specifically about, can an agreement for services be longer than 4 months?
So in our system, we have a feature called Care Now, Pay Later, which is kind of a play on the buy now, pay later in the retail industry, but it's Care Now, Pay Later. The ability to deliver care to a patient and have them pay for it later or pay for it over time. And really what it does, Bill, is it allows that provider to continue to care for their patients. Again, sometimes a dental procedure could be $2,000 out of pocket. That's a lot of money for somebody. That's a lot of money for anybody. And what they can do, what a patient can do is actually go, I can't afford it. I'm gonna walk out of the office and not receive that procedure because it's just too expensive. So what we can do with our application, again, on top of all the other things that we did, is we can have that provider say to the patient, well, $2,000, how about 4 payments of $500? And that can work for the patient. Now the patient may say, that's still a little steep. Okay, how about 10 payments of $200? Now, and that's completely up to the provider in our system, Bill. We're not using a bank. We're not getting bank authorization. We're not selling the loan. We're not issuing a new credit card for the patient. What we're saying to the patient is you have a current credit card, or you have even a current checking account, or a current debit card, or a current FSA card, or a current HSA card. You have a really high dollar procedure. We understand. We, the practice, or we, the doctor, are going to go ahead and allow you to pay for that procedure in little chunks over time. And really it resonates a lot with patients because I think it gives the provider a level of compassion. It also allows the provider to deliver a lot more care. That patient that's questioning that $2,000 procedure is now not walking out the door. They're going, oh, great, I can do a payment plan. And then, sorry, it was a long answer to your question. It can be anything the provider is comfortable with. If the provider wants to do $100 a month for 20 months, sure. If they want to do 2 payments of $1,000, sure. It's really up to the provider and up to, I would say, how well that provider knows the patient. Because I promise you, the provider knows the patient better than any bank does, especially if it's an established patient.
Go ahead, Brian.
Sorry, and on that note, orthodontics does this extremely, extremely well. $200 every month for 24 months. It's what we do in ortho. So the ability to run those recurrings, to go out and automate the card updater, think of Netflix. Netflix is a great example of this. That's just all built into our solution. Take that a step further. We've actually found statistically patients would rather have a payment plan on their existing credit card. I travel quite a bit. I have a United Rewards card. I would rather have it on my individual credit card getting the points than having to file for a third line of credit. So by offering that, it's all about giving options. That is what the point of Care Now, Pay Later is within the recurring. So Ortho's been doing it very, very well for a lot of years. We're bringing that in now to the GPs, the endos, the high ticket items that we've seen a massive increase of. And again, this in the past, 18 months, we've seen a hockey stick effect of Care Now, Pay Later.
So yeah, it sounds like it's well suited for orthodontics. That was a great question that we got in here. And yeah, typically over a 2-year time frame, you may be, some small payments, but it's over an extended period of time. And you said, Brian, that you're finding that with some like maybe implant cases or endo, or where people want to spread that out.
The thing we hear in endo all the time is a third, right? A third today, a third a week of, and a third the day of, right? That is just what they're providing because it's a big ticket item. It's $2,000-$3,000 procedure. So we hear that every day. So you can take that down payment, for lack of a better term, and then do a 2-month or a 2-week installment so you can spread it out for the patient. And then going back to the loyalty piece of this conversation, Bill, patients shop that. They see who will offer them a Care Now, Pay Later option versus what office won't, and they will make a decision based off of that flexibility.
That's great. So we've got about 10 minutes left here, and I've got a couple more questions, and then I want to just leave about 5 minutes at the end for Brian and Mike to kind of wrap things up a little bit. And we have a QR code, which is kind of cool. We're pretty used to QR codes, right? So if you want to learn more, and again, there'll be a recording of this, and we'll have Brian and Mike's contact information if you want to go old school and email them, or even pick up the phone and give them a call. That still works too. Actually, I'd say probably 3 or 4 questions we had tied around either patient financing, right? So some of the third parties out there, like a Care Credit or some of the others that exist. And then kind of on top of that, do you work with some of these membership plans that exist? Because there are more and more membership plans, whether it's Clear or some of the others. Talk a little bit about that. And it's 2 separate questions, but.
Yeah, I'll sort of tackle the financing one. Again, we feel Care Now, Pay Later does a pretty good job of addressing that patient affordability question of a high dollar procedure, or braces over time, like Brian was saying with ortho. So that's a really good option. But there are instances where some providers only see the patient once and they don't have a very good established relationship, or the patient has not paid the provider before. And that's happened a lot to providers, but providers, again, they continue to deliver care because their goal is to fix your teeth, or their goal is to make sure your well-being is there. So when we think about those, tying in patient financing from a bank or from a Care Credit starts to make sense, because the provider doesn't want to extend the credit. The provider wants to deliver the procedure, wants to have the bank pay the provider for the procedure minus a fee, and then the bank can go to the patient for the payments. And there's a lot of models like that work. What we try to do is we try to make it that secondary option. Care now, pay later is going to be our first option. Where, yeah, absolutely, patient, you're having a high dollar procedure. We know you, we know everything about you. You've been coming to the practice for 10 years. We're not going to have you go apply for a new credit card or apply for a new loan for this procedure. We're going to go ahead and help you out. But the latter kind of helps for some of the unestablished patients or maybe some repeat offenders that don't pay like they're supposed to. So I think the latter is where that fits in, and Rectangle Health has relationships with a couple of the vendors out there.
That's great. Brian, you want to touch on the membership plans?
Yeah, absolutely. So we actually work with some of the largest membership or discount dental plan organizations in the country. So we're very familiar with this model. Just like everything else we offer, we could bring this to your organization. So whether you offer them today or are looking to offer them today, that is something we accommodate, and we have probably a decade's worth of experience doing that type of payments. There's a lot of good vendors out there, Clear being certainly one of them. But again, our entire talk track is and will always be consolidation. So I think membership plans are a very cool function, and I think that's something that a lot of offices are going toward. Is I think there's a lot of value to it, and we certainly have the experience to either talk more intelligently about how that would work, what type of plans you should be offering, propensity to pay, et cetera, to the DSOs. And then again, they can white label these. So XYZ DSO discount plan or membership plan, they could kind of make it their own, just like everything else we're going to offer.
Yeah, and to sort of add to that, Brian, the DSOs are probably better at the dental side of a membership plan than we're going to be, and they're probably excellent at it. Where we come in is there's the whole payment side of how is the member going to pay their member fee every single month, and it's a lot like Care Now, Pay Later. So think of Rectangle Health in the background. We have this big giant engine just running payments all the time. We can actually do the payments for the membership plans. So if a DSO wants a membership plan out of the box, we can do that. If a DSO wants to build their own membership plan and they're just looking for someone to do the payment side of it, we can do that as well.
Thanks, Mike. So yeah, if anybody's interested in finding out anything more about Rectangle Health, you can use this great QR code, which is so cool. You actually have the R in the middle too. I don't even know how you do that, and it still works. I tried it out earlier. Let's wrap things up. This was a question. This is the kind of question I like to ask anyway, but this did come from, actually came from Synergy Dental Partners. So thanks for asking this, because I would have asked it. But let's talk a little bit about the future, of payment technology, kind of what cool things you're seeing, or maybe give us a little bit of an idea of what you're all working on.
Yeah, I'll go first, Brian, if that's okay. And
Yep.
you kind of helped me with my answer, Bill. You're looking at the future of payment technology. So a lot of times we walk into a medical dental office and there's a device to make a credit card payment. Well, what if there was just a QR code on the window? I know a lot of dental offices, they have the piece of glass right when you walk in at the front desk. What if there was just a QR code there and you took a picture of it with your phone, and that's how you paid your bill, or that's how you put your card on file, or that's how you registered? That's really the next wave of technology. Is that experience, and if you've been to a restaurant lately, you pay at the table now. They don't take your credit card back to some magical room and swipe it. They bring a receipt out to you, you take a picture of it, and it gets paid. That's the type of technology that you're going to see in healthcare, where when the patient checks out, and they always check out in a dental office, and you kind of give them the results of the day's visit. On that bill, or it won't even be a bill, it's just the results of the day's visit, there'll be a QR code. Patient will take a picture of it, and that's how they'll make a payment. So I think that's probably one of the big next waves that you'll see, is sort of the elimination of those payment terminal hardware, and really the ability for everybody to pay via something like a QR code.
Yeah, that's great. And certainly, kind of going back to what you mentioned at the beginning, Mike, of this webinar was, COVID made things change, right? You talked about the restaurants and the QR code, that comfort zone. So again, it's kind of pushed everybody to this technology, which really makes things more convenient. but it wasn't necessarily done out of convenience. It might have been done at the time with COVID, just, to kind of keep, whether you kept people out of the office for a certain amount of time, or you didn't want them to touch, in the case of the restaurants, a paper, menu.
Yep.
Brian, you have anything you want to add?
Yeah, I think the only Mike touched on at the end there, in my opinion, I think the where everything is going is this right here, a smart device. So when we think about hardware, I think it's going to be obsolete. I think we're a year or two away still, but we're working our best to get rid of hardware. We're not big fans of hardware. It's just a necessary evil right now. So I think in the next 2-3 years, it's all going to be smartphone. That is the way things are going.
So no terminals at all eventually, or maybe one in the back just in case, but.
Something, yeah, but everything's going to be done via digital text, QR codes, et cetera. So that is the way we're seeing the market go.
Well, that's great. That's exciting. Great way to end things with some interesting technologies. And it was just kind of cool to see that QR code, and that's the future. And when we prepped this yesterday, it didn't even exist, right? You guys threw that in there at the last minute. So I'm glad you did. Any final thoughts, Mike or Brian, before we shut things down here?
No, I just had one quick one, Bill, and we did a lot of talking about rectangle health, and Brian and myself get to talk about ourselves a lot, but we certainly wanted to thank you for doing this. This is really, really interesting, and it's really good that you kind of put it all out there for people to listen to and people to hear it. That's something that we thank you for doing.
Oh, absolutely. And it's always, I learn a lot, and I hope the audience has as well. And you can see that we've got Brian and Mike's contact information, phone number, email address. We will follow up tomorrow with an email, just giving you a link to the recording. And then also, again, the contact info, so you can make sure that you contact Brian or Mike any way you want, through the QR code, through email, or through a phone number. I love it. So thanks again, everybody, for attending the Group Dentistry Now DSO Study Club. Again, thanks to Brian and Mike and Rectangle Health for participating. And until next time, I'm Bill Neumann. We really appreciate it.
Thanks, Bill. We appreciate your time. Bye, everyone.
Bye.